Hey guys, hi, welcome back. How you all doing? I'm Dr. Sylvia. I'm a general practitioner, and welcome to AskAwayHealth. Thank you so much for joining me. I know there's been a bit of a mix-up with my times for this particular video because I thought I wouldn't have time tonight to film this live, but so it was planned for tomorrow evening, but then things changed. So I thought I better just show up tonight and let tomorrow take care of itself. But yeah, I'm so glad to have you guys here, especially if you're watching live. Thank you so much for joining. Let me know where you are and what you're up to tonight. It is evening in the UK where I'm based, and we've had a very rainy time here in South Yorkshire. So let me know what the weather is doing like at your end. I'm really I'm not sure what the word is, but I really wanted to share this video and share the experience of this lady that we're going to meet in a couple of moments. I came across the video from another YouTube channel, somehow turned up on my feed. And when I listened to the story, I thought there were quite a few things that we could take away from her story and that we could learn from. So I'm going to be playing a little bit of, I'm going to be playing the video, but not showing just the audio. So we're not going to see the video because I don't want to infringe YouTube community guidelines. And I'm going to be stopping the video from time to time, just so that we can have a chat about what we've heard and just, clarify some points or, question some things that are being said. And I'm going to ask you to put your detective hat on because, clearly we're just hearing a little bit of the story. The entire video is about 15 minutes long. So we're really just hearing a little bit of the story, but she tells it well and gives us a little bit of an idea of what she's been through in this cervical cancer journey. So if you're just joining, hi, welcome, and thank you so much for joining. Please like this video and of course consider subscribing to the channel. There's lots of health information videos that we put on different topics around sexual health, around women's health, and much more. Okay, so the topic really is about cervical cancer, but I'm just going to keep my disclaimer on the screen as usual because we're here to provide information for educational purposes. I can't make a diagnosis. I'm not your registered practitioner, and I don't have access to your full medical background, so I really can't tell you, well, do this or do that. I will provide information by way of education and awareness, and then encourage you to speak to your own practitioner. Always speak to your own practitioner. They have access to your medical background, can ask you so many different questions, can arrange a physical examination and all the tests that you require. But you're very much welcome here because we can learn and we can share information to help us learn things better. So we're looking at somebody's experience of cervical cancer. I'm just going to bring up the video so that we can share it. And like I said, I won't be able to share the let me just put this on the screen. I won't be able to right, let's see, click the screen icon in your address bar. Right, okay, let's see, let me see what you guys can see and make sure that you can see things clearly. Bear with me. Let me just double check. Let's put this back on. Let me just double check that we are able to see things properly. Give me a second, guys. But while you're waiting, let's have a think about what experience have you had with cervical cancer. Hang on. Okay. Oh, it is showing. Okay. But it shouldn't be playing that music. So why is it playing that music? Hang on. Oh, it is showing. Okay, hang on. So, right, why do we have this music playing? Okay, looks like it stopped now. Right, why do we have this music playing? Yeah, it stopped. I wonder what that was about. Looks like it stopped now. Interesting. Right, why do we have this music playing? Yeah, it stopped. I wonder what that was about. It stopped now. Interesting. Okay, so let me know if you can hear me okay. It would be really useful if you can hear me on the comments. I've just checked my phone and I think the sound is fine. And I think the visuals are fine because I really want to make sure that you can hear the audio when I start playing it. So please let me know in the comment section if you can hear. So we're just going to keep this on screen while we go and play this audio of this lady's story. I'm not going to, let me just keep quiet while we start playing. Her name is Gwendolyn, and she's just been very gracious to share her story. This is from the channel The Patient Story right here on YouTube. I will definitely share the link for you in the description box. But yeah, let's listen.
My name is Gwendolyn Jackson. I'm from Houston, Texas. I used to be a case manager. I used to house homeless individuals. I'm a founder and CEO of a nonprofit organization, the Roy L. Jackson Community Outreach Center, and I'm also part of an organization they call Survivor. When I would go for my well woman exam, and I would tell my doctor, hey, I'm having heavy cycles, I'm back pain, bloating in the stomach, he said, I think you have steroids. It's very common in the African American community. That's what it sounded like to me.
Okay, so that's our first pause, because this, I couldn't work my head around this, and I think maybe she's just misspoke, because you know, she can't have steroids. That's not a diagnosis. I think what she meant to say was fibroids, and fibroids does come up a little bit in the video, as you will hear as we proceed. I think what she's saying there is that the doctor thought with those symptoms, what were her symptoms? So she complained of a change to her periods. They were heavy. So she's still having periods, but she found that her cycle is heavier. She's talked about really bad back pain and feeling bloated. So those are the symptoms she went to her doctor with. And they said in the first instance, okay, probably fibroids, which on the face of it is not an unusual, it's in terms of fibroid symptoms, and you guys will know I talk about fibroids a whole lot. Guys, please let me know if you can hear me, my audio is fine. I keep checking on my phone. I'd really appreciate if somebody would just put on the chat and say, yes, audio is fine. So I know I'm not just talking to myself. Okay. Right. Let's carry on. So that it's not out of the ordinary, or it's not, I don't think it's inappropriate to think of fibroids as a potential diagnosis, but the pitfall is when the doctor just fixates on that particular one symptom without doing further checks. I think that is where there is a problem, but it's absolutely reasonable to put fibroids on the list of possible causes of that group of symptoms: heavy menstrual bleeding, number 2, feeling bloated, and number 3, severe back pain. Hi, that's really great. Thank you so much, Agnes. I appreciate that. And welcome. Thank you so much for joining. And guys, if you have any thoughts around this topic, cervical cancer, questions around the topic, please feel free to share with me, and we'll be happy to look at them together. So I was just saying that based on Gwendolyn's symptoms, her doctor's initial thoughts about fibroids seem to make sense. The problem is just sort of stopping there and not assessing further. But let's go on and hear what else she says.
We'll run some more tests. And then I kept having like symptoms. So I went to my mother, because I'm that girl that think mom can fix everything. So I was like, hey, I'm having, very heavy cycles. I don't know what's going on. The doctor said he's going to run some tests. He haven't called me back yet. And she said, you're going through premenopause. I went through the same thing, same age, just premenopause. So cycles wasn't getting any better.
Okay, let's pause it again here. And I think this is really useful, because do you guys remember, or did you hear about the passing of Jessica Petway, the social media influencer? When was it? Well, I think it happened 2 months ago or so, and we also did a live stream around her experience, because that was also cervical cancer that was misdiagnosed, that was missed for several months. I think her heavy bleeding symptoms started middle of what year was it then? Around August or July or something, and it took her how many times of collapsing before she was eventually diagnosed? I think in February, and she had really very heavy bleeding. Yeah, Agnes is saying, yeah, exactly. So the reason I brought it up is because one of the things that Jessica did was to talk to her community. She said, and which is great, you have a supportive people around you, and you want to know, hey, has this happened before? And Gwendolyn shared her story with her mom, and again, there isn't anything wrong with what her mom said on the face of it. And this is what one of the things that makes medicine interesting and a conundrum as well, because absolutely, if she's in the right age and she is perimenopausal or approaching menopause, that sort of transition period before you properly get into menopause, your cycles are going to do exactly this. Cycles are going to be irregular. They could be heavy. And here is mom saying, yep, this is what happened to me at this age. And so it makes sense to think, right, it's probably the menopause. And this is somebody living her life. She's living her life. It's not, these things are not just going to jump up and sort of announce themselves, hey, yes, this is cervical cancer. And even the doctor, it's probably easier in retrospect to now think, right, when you hear about the story, you can easily make the diagnosis. But when you're sitting in front of her and you're asking these questions, and then the doctor might ask about menopause given her age, which she didn't tell us, by the way, but she's mentioned that, and her mom says around this age. So let us presume that she's a lady probably in her mid-40s, maybe, I guess mid-40s, heading towards 50 or thereabouts. And her mom says that she experienced this. It makes sense for another potential diagnosis, menopause, to go onto the list. And menopause can also cause all manner of sorts of symptoms. There could be discomfort in the abdomen that you could sort of class as bloating. There could be joint pains that might explain the back pain she's getting, the fatigue, and all sorts of different things. But there's a time when, as a patient and as a doctor, you sort of have to sit and think, is there something else that's going on? So I wanted to just raise the fact that there different things could sort of come as red flags. So somebody's thinking fibroids, and actually fibroids does fit the picture. Somebody else says menopause, and actually menopause could fit the picture. Okay, but let's go on. Let's see what happens next in the story.
So I finally went to my doctor, and he ran tests, and he did the HPV test. My HPV test came back negative. So he was like, okay, my pap smear came back negative. So it wasn't that my doctor didn't do his job.
Okay, I have to cut in again. I have to cut in again here, because they hit on the right spot. So the doctor agreed to do tests. They didn't just say, oh, it's fibroid, get on with it, thank goodness. The symptoms, because fibroids can be asymptomatic, they may not cause symptoms. Some women have fibroids and nobody knows about it, but other women have fibroids and have really bad symptoms. And in this case, the doctor wasn't just assuming, they proceeded to do tests. And one of the tests they did was the HPV test. And that's why I've got this up on the screen, just to remind us about what happens during a cervical or pap smear. So in the UK, where I practice, we call this the cervical smear, and basically have what across the pond in the US, they refer to as a co-test, where there's an HPV test plus the pap smear. But essentially what's happening really is that the doctor is taking, and I hope this graphic is showing really nicely, but this is the examination where the speculum is put in place into the vagina, and the doctor or whoever is taking the sample uses a tiny brush that they gently rotate around the cervix, which is the neck of the womb, and that's what you can see sort of like in the top middle bit of the image, and sort of rotates it, or sort of goes around the cervix a few times to get samples around that, within the opening of the cervix, because you want to pick cells in that area. That's where you're likely to find if there is the germ, the HPV, which is the human papilloma virus, which is what we associate in terms of causing cervical cancer. It is most likely associated with the cause of cervical cancer, and that is not all strains of HPV, but the strains 16 and 18 are linked to cervical cancer happening in about 70% or more of cases. So really, when we're talking about causes of cervical cancer, this infection with this HPV germ is so important, and that's why vaccination is so key, and vaccination early, before people even start being sexually active, so that we're trying to prevent them having the infection, because having the infection increases the changes in the cells that lead to cancer. Okay, but I was talking about how this test is done. So this is what it looks like. That's what happens during the cervical or pap smear. So when she says my HPV test was negative, that means they did this test and they didn't find the HPV germ in her sample. And then the pap smear is the second bit, which is actually looking at the cells and trying to see is there any abnormality that might indicate a change which will suggest cervical cancer. And in both instances, it was negative. So really, in terms of treatment, I think the importance of emphasizing this is that please don't ignore your cervical smear or pap smear or HPV tests when they're due. In the UK, we have the cervical smear program for women or people with the cervix aged. So that's trans men or non-binary people who still have a cervix, aged from 25 to 64. So you're called to have your test, and this is what you go through. It's a test for a few, literally 10 or 15 minutes or less. It shouldn't be painful. It can be a little bit uncomfortable for some of us, having the speculum inserted, but that test, can help us detect if there are any signs of the HPV infection or any changes that may indicate cervical cancer in future, which can then be treated. So that's what that's about. But let's go back. So Gwendolyn says she's having all these tests, and she says that her HPV, so they didn't find any signs of HPV, number one. There was no sign of HPV, and there was no sign from the pap smear that there were any changes had happened in that portion of the cervix that could suggest cancer. So I know you're asking, so how did she end up with a grade 4 cancer if her HPV and smear tests were normal? Now, apart from the obvious, where you might say, well, maybe something went wrong with the test, or you might say, well, maybe the particular cells that they checked didn't contain, that we can sort of think widely. We can just go to town and say, why could that test not have picked things up? But I also want to chip in at this point that for some women, cervical cancer doesn't show any symptoms. Okay, we say, oh, cervical cancer, if you have bleeding in between your periods, if you have bleeding after sex, if you have changes to your menstrual period, and some of the things she's talked about here, go and see your doctor so that we can exclude things like cervical cancer and so on. Some people don't have symptoms. Now, I'm not saying this is the case for Gwendolyn. I'm just trying to get our mind thinking broadly so that if something nudges your mind, if you're worried, if you're concerned, keep insisting. Could it be this? Could it be that? And we'll hear what Gwendolyn says about this a bit later on in her video. Guys, if you're just joining, you're very much welcome to the channel. We are talking about a lady who was diagnosed with stage 4 cervical cancer, despite her HPV test and pap smear, cervical smear showing no abnormalities, despite her being otherwise well in herself, nothing else suggesting that she was going to develop cervical cancer. And we're just sort of talking through her experience. Thank you so much for joining. And yeah, I'd love you to join the conversation. Let me know what your thoughts are about this kind of case, perhaps your personal experience, either yourself or somebody close to you, a friend or someone close to you, or any questions around this subject. And of course, give this video a like and subscribe to the channel. Where's my ticker thing? Because I always forget. So don't forget to like and subscribe. Let's leave that on just to remind us. Okay, guys, let's go back to the video and continue listening.
We don't know how everything just went through, and I was one of the ones that, hey, this happened to. So he did everything. He ran all the tests. He did everything. So I was still having symptoms. So what he said, hey, I'm gonna do an ultrasound on you. He did an ultrasound, just a regular ultrasound. And he said, I see fibroids. He said, so I recommend that we might have to do a hysterectomy because you have fibroids. I was at work and I started leaking from my vagina. I was leaking clear fluids. And I have had kids before. So I was like, I'm too old. I know I'm not pregnant. Um, so because it almost felt like my water bag would burst. That's how the fluids was leaking. So I was like, okay, now this is not good. So I went to the emergency room and I wish I could remember the doctor name that really saved my life.
Okay, let's pause and let's just reflect on some of the things that we've heard. So, she's had a scan and she did have fibroids. Okay. And again, like I said at the beginning of this, you've got to put on your detective hat and just try and piece things together. We don't have all the information, but it's still useful to have this kind of story because it helps us. It helps us to not just if we hear this kind of experience that someone has, or in terms of our own symptoms, it helps put us in the right direction. So anyway, she had a scan and it shows that she's had fibroids, and the doctor is thinking about a hysterectomy, and there might be different reasons for this. It may be her age and the fact that she's finished having her family, because she mentions that she's got children. It might also be the severity of the symptoms, and they think, right, this is the best way to remove the possibility of the fibroids causing these symptoms or even growing back. If you choose other treatments like myomectomy, which is removal of the fibroids themselves alone, or uterine fibroid embolization, or medication, for example, where the fibroids could recur. So this was the conversation. And again, we don't have a timeline. We don't have a timeline of what was, when all this started and at which point things came to a head when she says she was at work and all of a sudden she's leaking a clear fluid. And, what does that mean? It might indicate that because we know, of course, in retrospect, that this is cancer this lady is dealing with. So we know that. So perhaps the cancer had spread to a particular area within her body, within her reproductive tract, and it was causing liquid or mucus, I presume, to leak from her through the vagina. We don't know. It doesn't go into much detail, but just sort of assuming the way cancer works when it grows, the kind of discharge that might happen. That is my supposition. So now she's now coming to the emergency room. Remember, nobody has talked about cervical cancer. She's had negative smear, negative HPV, negative pap smear. So she's not showing any sign that it could be cervical cancer. That is not yet in the equation. So let's carry on listening.
When I went to the emergency room, and it was an older doctor there, and he said, "Hey, I'm like your doctor. There are fibroids." But it was a young doctor there that just became a doctor. And he said, "Hey, I want to run some more tests on you. I just don't feel comfortable with everything you have told me." He said, "Hey, what can we lose? Let's do an MRI." So he ran an MRI. He came back and he said, "I see fibroids, but I see something under the fibroid."
So, here I just want to, shout out that it's not the age of the specialist. It's not the age of the specialist. You need a specialist that is a doctor. Well, it doesn't even have to be a specialist. Even your family doctor. So not any practitioner really. It's not the age. You need somebody who is committed to, who's listening to you, who's committed to you. Did you hear what she said? This person said, "I'm not comfortable with what you're saying," and I think that's what we do in medicine. And we don't want to just assume. It's easy to sort of go on. She's got a history of fibroids. Yeah, this is probably the fibroids. I mean, I don't know of fibroids causing people to leak from the vagina. That's not a symptom. So I don't know what that will be. And like, if I were in that position, I'm hoping that I too would say, this doesn't really add up. Why would fibroids be doing this? What's going on? So I think the message here is, some of us might be looking at, let me see the most experienced person, which, yes, experience is important. But in this instance, it was a young doctor, she says, as she describes, who just wasn't really satisfied with going with the status quo and wanted to push a little bit more. So I think it's about, thinking widely and thinking outside the box. If you're seeing a younger, quote unquote younger person, don't just assume, oh, they're not as experienced as the other person who maybe is 10 or 15 years older than them. And it is true that having 10 or 15 years older in practice allows you to have certain levels of skill and so on. But being young or just finishing from recently graduating from medical school doesn't mean that doctors haven't been trained, because the training is quite rigorous. Even as a student or as a junior doctor, the training is extremely rigorous. They're the ones on the front line before the consultants come into play. Lots of research that is coming up every day, and these are being taught in medical school. So do you know what? I'm just saying, think widely, because you want experience, you want knowledge, you want compassion, you want empathy, the mix into your practitioner. Okay, so so next, now we're at an MRI, and the MRI has been done, and he says, something seems up. I can see fibroids, yes, but there's something else, and this is where she now gets her referral to the specialist. Okay, next up, let's see what happens.
He says, so I'm gonna have to send you to a specialist, a gynecologist specialist, so they can run more tests, because I'm not sure. But he put on my paperwork cervical cancer. So I went home. That was the worst thing to do. I got on the internet. I was searching cervical cancer, and my father passed from cancer. And I was already a daddy's girl grieving. So when I saw cervical cancer written on that paper, I lost it. I was like, oh my God, do I have cervical cancer? He wrote it on the paper before they even found out I had it. So I go to the specialist. The specialist tell me we got to run a biopsy. Calm down. She was like, don't worry. You're pretty healthy. I see all the test results they have done. I don't think you have cervical cancer. It might just be the fibroids. He's missing it. So they did a biopsy. I went in there thinking I just had fibroids and left cancer. And it's like when you first hear you have cancer, I don't know if you ever watched Charlie Brown when it's like, and you cannot, it's like it's not registering. And I thought, not me. For some reason, I thought I was exempt because I was running a cancer organization already. I was helping people with cancer. I started my nonprofit in memory of my father who died from lung cancer. So I was like, I eat right. I was running like 5 miles every morning. What did I miss? I don't smoke. I don't drink. They did a full hysterectomy.
Okay, so let's pause it there, because there's a lot of information that's that she's just shared with us. So okay, so she's been referred by the emergency doctor, by the ER doctor, who had suspicions that something wasn't kosher. They thought there was something else going on. So he said he sent a referral to gynae, let them look at it, see what's going on. She came to the specialist, and the specialist says, it's probably fibroids. Don't ignore those emergency doctors. They're always panicking about things. I'm just kidding. But she came to the specialist, and the specialist, well, maybe they were being reassuring, perhaps, or maybe they were, I don't know, maybe they felt on the basis of probability, given her symptoms, that it was likely to be the fibroids. But to cut a long story short, as you heard, she went in there thinking it was fibroids, and she came out dazed because it was cancer, and it was at the point where she needed to have a hysterectomy. So this is the story. What did I miss? She says, did she didn't miss anything. She's doing all the right things. What is it that we tell ourselves? We say, keep fit, eat healthy, exercise, don't smoke, don't drink, or cut down on smoking, cut down on drinking. So she's ticking all the boxes for the lifestyle changes or the lifestyle practices that you should take to avoid the diagnosis of cancer. She mentions that her dad had lung cancer. So, you might think, well, is this something in the family? Well, as far as I know, no direct link between a family history of lung cancer and somebody developing cervical cancer. But, if one person in the family has had cancer, of course, it just sort of puts it in your head to make sure that you're checking, you keep cancer sort of in your periphery as a practitioner in terms of their possible diagnosis. It's different from things like people with the BRCA1 or BRCA2 genes, where somebody might have, in the family might have breast cancer, and then there might be an increased risk of other types of cancers like ovarian cancer in the same family because of that gene. So she's at this point where her life has been turned completely upside down with this diagnosis. And thinking about it, as far as the information we have in front of us, we can't really put a finger on how she could have ended up with it. I think this is probably a good point or a good time now for me to talk about potential risks of cervical cancer, just in case anybody's listening here and you're not familiar, or maybe on the replay you're not familiar with this and you want to know. Give this video a like, guys, please. That would really be appreciated. And if you can share this with your friend, if you're watching, I know there are a couple of people watching now, and if it's useful, please share it with your network. It might help somebody. On the screen at the moment is the tools that we use for doing the smear test. So you've got the AIRS brush, which is it's actually very flexible. It's not painful. I know it looks big, but it's just, you can see the little tips of the brush are just to help to strip cells off the inner parts of the cervix that is called the os, so that we get enough samples of the cervix. And then the container that's been held in the other hand is where we put that head of the brush, and it's sent off to the lab to do the tests. So we're talking about the risks of cervical cancer. And one of them is age. Let's just dive into it. Okay. One of them is age. But before I do that, actually, I did mention it at the beginning, but let me just mention it again, that a persistent infection with the human papilloma virus, HPV, in the majority of cases, strains 16 and 18 is associated with cervical cancer. HPV also causes genital warts, but it's a different strain. So the strain that causes genital warts is different from the one that causes cervical cancer. So HPV can be passed through close skin-to-skin contact. So that's like what happens during sexual activity. In the majority of cases, right, our immune system will clear about 50% of HPV infections. So actually, somebody with HPV may not even develop any symptoms that, when we talk about sexually transmitted infections, they will say, oh, chlamydia, gonorrhea, trichomoniasis. Have you ever heard anybody we don't sort of shout HPV from the rooftops, because it may not cause any symptoms. It hasn't actually got any specific treatment, because your body literally can clear it. And this is why it's important to have that vaccine early on. For those who, the body doesn't clear it, because like I said, it's only 50% of cases. And, for those who, at some point may not be going for their smears, or for some other reason, or they might have a higher risk than usual because of some type of behavior that makes them more likely to develop cervical cancer. But the bottom line is HPV infection is associated with developing cervical cancer. So if you have a long-lasting infection, you are more at risk of developing cervical cancer, a long-lasting infection with high-risk HPV. All right, so age is the next risk factor I want to talk about. It's actually more common. When we think about cancer, generally, it's something that happens as we grow older, and generally across the board. Of course, we have cancer that happens in young people, blood cancer, leukemia that can happen in young people, or other types of cancer. That is true. But broadly, you tend to see it more often in older people. Cervical cancer is more common in sort of the younger to middle aged years. In the United Kingdom, most cervical cancer cases diagnosed each year are in women aged 30 to 34. Okay. In the US, according to the American Cancer Society, according to the American Cancer Society, I was just checking to make sure that I was referencing from the right source. Cervical cancer is more frequently diagnosed in women between the ages of 35 and 44, with the average age being 50. And they actually comment that it rarely develops in women younger than 20. And what we had in the UK, I think is going to 10 years, but of course I can't forget her, is Jade Goody, who was in her early 20s when she was diagnosed. And she was a Big Brother that she was in. She was one of these, what do we call them, these influencers, back then when Big Brother was still a sort of fairly new thing, but she was one of the what do we call them now? Competitors, or one of the people in the house, in the Big Brother house in the UK. So she was already popular. And then when the news broke that she had been diagnosed with cervical cancer before she was even eligible for the cervical screening, that brought a whole new level of awareness to this condition. So Jade Goody is somebody who we remember her story, her experience was documented until, she sadly passed. And, just, thinking and hoping that her family is doing well. But she is somebody that I remember back then, I think it's like 10 years ago or so, that, it can happen in young people, but it's rare. It's rare. Another risk factor is practicing unsafe sex. So multiple sexual partners, not using protection like condoms or what do you call it? Female condoms can increase the risk of catching HPV. Remember, we said is spread by skin to skin contact. And the other risk is, of course, not being vaccinated. I think I've said that so many times, you're probably fed up and tired of me, but it's really important to reference. So in the United Kingdom, all boys and girls aged 12 or 13 are now routinely offered the HPV vaccine, and it's supposed to protect against the types of HPV most likely to cause cancer. It doesn't protect against all the types. It's important to reference, which is why it's still important for women and people with the cervix to make sure they have cervical screening and attend their cervical screen. If you're not receiving invitations, check in with your GP. Ask them, you're supposed to have cervical screening, and, find out where you are in the program and so on. Next, sexually transmitted infections like HIV, sexually transmitted infections like chlamydia, having them can also increase your risk of cervical cancer. Smoking tobacco increases your risk of getting cervical cancer, and the risk is greater the more cigarettes a day that you smoke. Okay, so the more cigarettes a day that you smoke, the higher your risk of cervical cancer. The other thing that is slightly associated with cervical cancer is the contraceptive pill. So the way to think about it is this: there's a slightly higher risk of developing cervical cancer with the contraceptive pill. If you've taken the pill for more than 5 years, that risk increases. Okay, but as soon as you stop taking it, the risk starts to go down. And by the time you get to 10 years after stopping, or by the time you get to 10 years, excuse me, the risk is just about the same as anyone who had never even taken the pill. And, this is also the same kind of picture that we see between the pill and breast cancer. But then we know that the pill can protect or reduce the risk of womb and ovarian cancer. So discussion to have with your doctor, discussion to sit down. I'm not trying to scaremonger or make anybody worried about their medication at all, but important to sit down and speak to your doctor if you're concerned about the risks or you just want to understand, where you stand. Another risk of cervical cancer is family history. If you have what we call a first degree relative, so someone that is like your mother, your sister or daughter had cervical cancer, then you have an increased risk of developing cervical cancer. We're not sure if this is related to faulty genes or whether it's, shared, you guys live in the same area or shared environmental factors or just being exposed to, the same type of factors. We don't know, but there's the observation that if it happens in someone, a close family relative, like a mom, sister, or daughter, then you might also be at risk. Okay, so I wanted to digress I thought that was a good place to digress, but let's go back into Gwendolyn's story and see how things get on with her.
They said, hey, we're going to go in. We can take it. We can take the whole tumor. They gave me, before they said, hey, after we take the whole tumor, you'll do radiation. That's it. Your life will be back to like it was. That's what I thought. December the 17th, I went in for the full hysterectomy. They found out it was 9 centimeters. They found out that I was before I went in, they found out I was stage 3B going in because it was in my lymph nodes. So, but they were still telling me, you'll be fine, radiation and all of that. Well, after we removed the tumor, radiation would take care of everything else. So I was like, okay. After the 6 to 8 weeks where I could go to radiation, I went to radiation. My doctor, for some reason, did some blood work. on me, and he was like, I'm concerned with the blood work. And I was like, what? He was like, the blood work never changed. Something is not right. He said, okay, I'm going to do an MRI and a PET scan. We got to see what's going on. So when they did that, they found out that my cancer spread it to my pelvic, um, the bone, my hip bone, my legs, all in that short period of time.
Okay, so let's take another pause here and have a think about what's going on. So she is into treatment now. They're feeling pretty confident, because thankfully there's been so much advance in medical treatment, in technology in the last decade, 20 years, in terms of these treatments that if detected early, at certain stages, then one has a good chance of actually beating the disease, and one has a good chance of of cure. So I just want us to have a quick look. I'm going to share my screen again because I want us to have a quick look at cancer staging, and I'm going to be referring to the Cancer Research UK. So we're going to have a quick look at that in a moment. But before we do, let me see. Okay, so yes, so what you can see on your screen now, guys, please like the video and subscribe to the channel. And I know it seems like I'm talking to myself. I'm not, I promise. I know there are people listening. If you find it useful, please go ahead and like this video. And of course, if you want to comment or you want to ask a question on this topic, you're very much welcome to do so. But on the screen at the moment, I'm just sharing with you a graphic of the female reproductive system, because I want us to have a deep look at when we talk about the stage of cervical cancer, because she's mentioned it now, and how when she says stage 3B, what does she mean? And when she says stage 4, what does she mean? Excuse me. Okay, so yeah, what you can see on the screen, so you can see we're talking about the female reproductive organs low down in the pelvic area, as you can see on the picture here, and magnified, you can see it's made up of the fallopian tubes, the ovaries, you can see the womb itself, and then the cervix is that short, tiny portion that juts or extends into the vagina. So it's the neck of the womb is one name for it. It's the first part of the womb, and it is the bit that juts into the vagina. So that's the cervix. That's the area of cancer that we're talking about. Okay, so this is it. This is a big close-up of that area that you are looking at. So that bit that you're looking at here, that you can see, it's sort of like a two-pronged fork where it says cervix. That tiny bit you're looking at there, this is it magnified. So this is the area where cancer can start to grow. And the reason I'm sharing this with you is because when we look on, and this is all Cancer Research UK imaging. So, when we go onto the site, like I want us to look at in a few moments, the different stages, you can imagine in your head, this is normal. So this is normal appearance, but then you'll see where the cancer is starting to grow. All right, so let's look at that. Let me go into their site, and so let's pick up stage 1 cervical cancer. Okay, so stage 1 cervical cancer means the cancer is only in the neck of the womb. I don't know if I can make this view any bigger. Let's try. So if you remember, okay, calm down. Okay, so if you remember what I was just showing you a few moments ago of the normal appearing cervix, this is a stage 1 cancer. And you can see that it is still very much within the cervix. I don't want to stop going to ABC where this is not that kind of class, but I just want to give you an idea of what the stage can mean. So in blue on this picture is referring to the degree of growth of the cancer. So that's stage 1A. You can also have stage 1B, where the cancer is still within the soft cervix, but is jutting into the vagina a little bit. And you can see stage 1B and how it is all. So this is all stage 1. That is, it's a cancer that is still local to the cervix. Okay, so let's look at stage 2. Remember, we're trying to understand what stage 3 and stage 4 are. In stage 2, the cancer has now properly spread outside the cervix into surrounding tissue. So let's look at what that looks like. Let me just magnify this view again. so that you can hopefully see. So this is the cancer now spreading. This is stage 2 now. Excuse me. So this is stage 2 that has now grown into the top part of the vagina. You could see in stage 1B and C how it was already extending. While in stage 2, you can see that it has grown in, a long way past that, way past what it was in stage 1B or C. And she mentioned 9 centimeters. And so sometimes the specialist will use the length or the distance that it has spread from, from the cervix to describe a particular stage. So this is stage 2A. You can have stage 2A1 or 2A2, in which the case the size of the cancer is 4 centimeters or less, or 2A2 if it's more than 4 centimeters. And then this is stage 2B, where you can see that the cancer is spreading. So this is what we mean when we're talking about the staging of the cancer. It's just a way of describing the extent of growth of the cancer, the size, what tissues are involved. So let's now look at stage 3, which is what she thought she had. So stage 3 cancer is cancer that spread from the cervix, is gone into surrounding tissue. So this is far beyond the vagina, the top part of the vagina. So this is stage 3A. I think she said it was stage 3B that the doctors thought initially. So this is stage 3A. They said the cancer has spread to the lower third of the vaginal wall. So you can see it's actually crossing almost the entire vagina, but it hasn't gone outside. It is still within the womb and the vagina at this point. Stage 3B now. So you can see this is clearly different. It is now leaving the what's it called now? The womb, leaving the cervix, leaving the vagina, is now going across. So it is, according to the staging, stage 3B means that it's grown through to the pelvic wall and is blocking one or both of the tubes that drain the kidneys. That's stage 3B. So if the type of cancer, or if the extent of the cancer fits into these criteria, it's known as stage 3B. Or if it's stage 3C, the cancer can be any size in the pelvis. It hasn't spread to distant sites, but it can be divided into stages 3C1 and 3C2, telling us about whether the lymph nodes, which everybody has lymph nodes, they're scattered all around the body, very important in the immune system, helping us to fight infection and inflammation, really key organs. But the other thing is that they are also very, very important in the spread of cancer, because cancer tissue can fall into the lymph node system and be spread around the body via the lymph node system. So stage 1C means cancer is in the nearby lymph nodes. So you can see the blue color. I don't know if I can make this any bigger, but hopefully you guys can see. The cancer has spread from the cervix a little bit into the vagina, but is now entered the pelvic wall on both sides. And we can see that the blue is already in some lymph nodes. So this is a stage 3C1. And then stage 3C2, the cancer has spread further and it's actually gone beyond pelvic lymph nodes. It's actually gone into the abdomen and is affecting the lymph nodes around the big blood vessel, the aorta. Okay, so let's just be quick. I don't want this to be too technical. Let us now look at what stage 4 is, because this is what Gwendolyn ended up with, stage 4 cervical cancer. And stage 4 means the cancer has spread to the bladder or the back passage or further away. I think she's told us that her cancer had spread to her hip bone. And did she say her spine? I'm not sure, but it had spread. So it spread considerably beyond the cervix, the vagina, the pelvic wall. It's actually gone into the bladder or back passage or bone. And so we're looking at something like what you can see in this picture here. This is a fast spread cancer. Now, the reason that all this spread and staging is important, the reason that, we want to know about these stages, let me take this off the screen. The reason why it's important for us to know about these stages is, of course, when it comes to treatment, because different stages might require different types of treatment depending on what else the patient or what else you might have going on, if there are other medical conditions, or different things that can determine the type of treatment. So in some cases, you could have radiotherapy, as she did, chemotherapy, surgery. They could add on immune drugs, hormone drugs, and so on. Depends on the stage. And of course, it just helps you to, it also gives a kind of prognosis, because when they told us she was at stage 4, they mentioned that she had so months to live. They wouldn't be saying that if she was at stage 2 or stage 1. So it gives that kind of indication. Okay, so we've looked at that. Let us now go back to Gwendolyn. No, let's use this other picture. I don't want YouTube to get all funny. So let's go back to Gwendolyn as she sort of rounds up her story. I think the other thing that's really important, I'd love us to hear, is what she says about her diagnosis and the treatment and care that she received from her specialists. So before she talks about the clinical trial, just a word about where she was with her treatments, which is probably another video, so we're not going to spend too much time on this, but just to reference the fear that many people have once we hear about chemotherapy, because these are drugs that are meant to kill cancer cells, and while they're killing cancer cells, they can also do significant amounts of damage to non-cancer normal cells and cause a lot of problems, lot of different problems. I've had personal experience with chemotherapy. My mom had breast cancer, and after her surgery, she had chemotherapy. And oh my goodness, that was a time that was, it was, she would talk about the different symptoms she felt: weakness, exhaustion, nasty taste in the mouth, lack of appetite, nausea, ringer, hair loss, and so on. So many different symptoms. It needs a lot of support for somebody going through this treatment. Even radiotherapy also has its own side effects. There, quite a list of different things. So it's a lot to deal with, and these treatments are these are strong medicines or strong therapies that an individual who is already weakened is being exposed to. It's really a lot to take in. She's going to tell us now about how she got into a clinical trial, which I think helped to make a difference, even if just in terms of how she felt and how she was getting on. And she's not in isolation. There's a family that she has that are trying to come to terms with this. This is a relatively young woman, middle-aged and otherwise fit and healthy, but has had this devastating diagnosis, being told that she's literally got less than 2 years to stay with her family. So this is really mentally, emotionally, physically draining. Okay, so she's talking about the clinical trial. I'm just going to speed it up a little bit just so that we're not here. Like I said, I'm going to put the link in the description box below. But I just want to go to where she talks about, yeah, she talks about the clinical trial. Let's just get to the bit where she talks about her experience and, sort of advocacy. And I think it's a really good place to carry on. So let me speed it up to that point. Sorry, I was going to pause. I thought she'd finished. So, this is a really key point. I have a few videos on my channel around advocacy. I think it's really important. Some of the things around advocacy are learn as much as you can about, health information. Look for health information from reputable sources. If you have a concern, speak up early about it to your health practitioner. If you feel you're not being listened to, find a second, a third, a fourth, or fifth opinion. Get somebody who you trust or who supports you to go with you to a doctor's visit to emphasize that this is not normal. Because, like she says about her doctor and the fibroids, they wanted to go to town with that fibroid story. They wanted to just run away with that fibroids, it's all down to fibroids. And, it took one doctor to say, no, I don't believe the fibroids. Let's look for something else. And that's how she ended up with a referral. And even the specialists at that point still wanted to put it down to referral until they had she had the further tests that indicated that, look, this is cancer. So it's really important about, learning how to advocate for ourselves as women. And I say this both from the cap of a doctor myself and having been a patient, because, I've also been on that side, of the divide, where you are the patient and you're listening to your practitioner and you are wanting to make sure that all the bases are covered. And I think we're not just at a place where we just listen to the doctor. It's not the doctor's role to tell you what's going to happen to your body. They can provide information to you and help you make that decision. At the end of the day, it is still your decision. And I think it's important that we know that we're working with our doctors and expecting them to provide us with as much information to help make our decisions, but also to be listening, also to be to show empathy when we are providing, telling them our story. And of course, she mentioned the hesitance for the African American community, or even Blacks, not just African Americans, when it comes to clinical trials here in the UK, where we were looking at the uptake of vaccines during the pandemic. There was a strong hesitance from from ethnic communities, not just Blacks, but we were in the majority. And of course, the fear was about, is this something that is being pushed on us by the establishment? And is it a test? Are we being used as guinea pigs? She referred to the Tuskegee syphilis trials, where American men back then, I think it was it in the 60s, or can't remember when, but where they were being used for experiments, syphilis, so-called syphilis treatments being given to them. So there is that that horror and distrust that rose up out of that. There are other examples of drug companies shipping products to different parts of the world, like parts of Africa, parts of Nigeria, where drug trials have been conducted, or certain vaccines given by certain companies without the kind of consent and scrutiny that they would have if they were being provided in countries like the US or the UK. So there is a lot that's happened that's created that distrust. So for clinical trials, as an African American, I can, this lady being an African American, I can understand her hesitance. But she's found out that the clinical trials were a positive experience, or are a positive experience for her. And she tolerated them much better than the chemotherapy. But I think what's also instructive is what she's saying about, it's not just African Americans, it's actually a woman thing, which brings us to another level of the disparity in terms of healthcare. That is the difference, the inequality, if you like. So we're talking about being Black or African American. Then the next level is being a woman and not even being listened to. So there's so many things I thought were so useful that this lady brought forward from her experience, and I thought would be really helpful for us to chew on. Okay. I don't know if we're going to have to remove that clip if we get the copyright strike because of the music. I don't know, but I thought it was great, fair to give her the last word on that. So that's the story. That's Gwendolyn's story that she's very kindly shared with the world, so that people will learn from her experience and learn about how she was diagnosed with stage 4 cancer. She didn't have the routine kind of risk factors as far as we know. She didn't have the, sort of, symptoms. She had heavy periods, she had back pain, bloating, something like that. You would also think about ovarian cancer. I think at her age, to be fair, in the United Kingdom, she would definitely need to have some tests if she came in with those kind of symptoms, severe back pain, bloating. We will do some tests and blood tests that might suggest to us that something more is going on. But again, we're putting on our detective hats on here. We don't know everything. We're just sort of going through what she said to us. But guys, that is the story. I hope you found it useful. Thank you so much for watching. Let me know in the comment section, maybe your experience, maybe experience of somebody else that you know, or how hearing her story has really helped you in terms of trying to focus and advocate for yourself, not be tired or afraid of speaking up. And that was that was Dr. Jane, a doctor who was telling her, when you go to the doctor's office, speak up. The doctor is working for you. And I think I always say it's not a matter of shouting at the doctor or being rude, but sort of being firm and being insistent and saying, no, I don't agree with this. And if you feel the doctor is not listening, or you're not getting to where you need to be, then seeking a second opinion. Well, that's me done and dusted, guys. Thank you so much for watching. Don't forget to like and subscribe. Come on, guys, this is useful information. Give it a like and share. But it's been lovely spending this hour with you, and I will see you again in another one. Let me know as well if you like this kind of format. I've toyed with this idea of doing a video like this, reacting to this kind of story. And if you find this useful, then maybe we can do this a bit more often. Let me know in the comments section. But guys, I love being with you. Have a great week ahead, and I'll see you again soon. Bye-bye.